All right. So Janice will.
All right. Hi and good afternoon, everyone. We are from Pacific Medical Training, and we are very happy to discuss with you the courses that we are offering right now, and we are looking forward to having some or entertaining some questions from Nova Southeastern University. We're very thankful that Emilio gave us this opportunity that we will be able to talk about the courses that we are offering. Well, we've been with the company for 12 years already, and actually we just started with ACLS course, but then we found out that there are still a lot of courses needed for Pacific Medical Training that we can offer. So that's why we are actually offering a lot of courses such as ACLS, BLS, as well as PALS. So we started from 2008, and then our main office is in Pennsylvania. So you will be able to see on our slide for the exact location of our office. So that is in Huntingdon Valley, Pennsylvania. So for the courses that we offer or we will be discussing today, that will be regarding medical scribe plus electronic health records. We will not be discussing some of the courses since that is not part of the continuing education courses. We will have to discuss about monitor tech, stress test, Halter monitoring, and preventing wrong site surgery. So this will be explained to you, explained to all of you by Sheila and myself. So let's start with medical scribe plus electronic health records, which will be discussed to you by Sheila. Sheila, I think you're on mute.
Oh, yeah, sorry about that. So thank you, Janice. Good afternoon, everyone. Thank you for joining us today. So my part is the discussion of Scribe course. So this certification program is actually designed to be present with the healthcare providers, such as the physicians, the physician assistants, nurses, nursing practitioners, during the patient visits. The primary responsibility of the scribe is documentation. So it is essential because you help the healthcare providers by focusing on the patient, and the physician will just be there to focus on the assessment and the treatment of the patient. So after gathering data during the patient visits, you will be able, as a scribe, you will also be able to organize the gathered data later on, and uh, organize the data in, based on the expectations of the doctors and the protocols or standards of the facility or hospital. So that's the background of the medical scribe. We'll go to the next slide. So the name of the course is medical scribe course, and the estimated time to complete the course is 8 hours. You can use any web browser upon registration, but we recommend recent versions of Google Chrome, Internet Explorer 9, and all newer versions, or Apple iPad. For the educational objectives, there are a lot of objectives that you can achieve after completing the course. But to give you a summary, of the objectives, you will be able to understand or identify the roles and responsibilities of a medical scribe. So you'll be able to understand the value of maintaining integrity and patient privacy, what we call HIPAA, or the Health Insurance Portability and Accountability Act. You will be able um, to do accurate and real-time documentation. You will also be able to learn how to document properly using the accurate uh, using an order, what we call SOAP. So we have that acronym SOAP. It means subjective, objective, assessment, and plan. So you'll be able to learn how to document properly. And lastly, you will also be able to summarize assessment data, plan, and discharge instructions from the from I mean as ordered by the physician. Other also you will be able to learn medical terminologies. So right now, when you are studying, when you are in your current education, you may have not encountered medical terminologies used in hospitals or in different facilities or specialty areas, but in this Scribe course that you may be interested in signing, there are medical terminologies that you will learn, such as bradycardia, tachycardia, hyperthermia, hypothermia, and also terminal terminologies regarding the position of patients, such as prone, supine, Fowler's position. So those are just examples of the medical terminologies that you will use. There are more and more. There are more medical terminologies that you will use, or you will learn. I mean. Also, as one of the objectives that you will be able to achieve after completing the course is you will be able to understand or to learn the billing process. So you will have the idea on how it is billed by the health practice. You will have an idea in such a way that you will learn the ICD, or the International Classification of Disease, the 10th edition. So you will just learn the basic and the common, such as those uh, um, emergency visits, the 99282, the 99285. So those are just examples of the ICD codes that you will learn. So next, we'll go ahead and discuss the EHR. By the way, the medical scribe I mean, it comes with the EHR course due to accreditation purposes. We have, I mean, last year we have EHR included in our medical scribe, and for accreditation purposes. I'll discuss it later in the next slides on regarding the accreditation. So electronic health records are, so you will be able to utilize, organize digital patient records. So nowadays there are a lot of health practices that use EHR in their practice. So it is common. So it's we have included it in the especially in the medical scribe course, because you will be dealing mostly with the digital patient records. The validity, I mean, the duration of this course is 2 hours. So for medical scribe, it's 8 hours. So with EHR, you will I mean, it is 2 hours, so a total of 10 hours for the entire course. The course preferences, it's actually the same with the medical scribe. I mean, for both the medical scribe, the electronic health record course, our preferences are, the course preferences are, of course, the physicians, the nurses, the physician assistants, the um, nurse practitioners, in a way that uh, this course meet their educational needs, for example, in their current nursing license, there are required CME credits that they will need to get within within their licensure registration before their renewal. So, and what I know in California, the nursing course is just valid for 2 years. So within that time frame, they will need to get, required number of CME credits, and so this, these healthcare professionals are one of our preferences. We also offering this to those in medicine program tracks, such as those taking biology majors, chemistry majors, and other pre-medicine courses. Um, so, this is to have good foundation because of the added learning, and this is a great start on their career. This is a great start on your career, actually, because you will have uh, uh, learning, and you will have experience on different uh, um, medical medicine healthcare related healthcare courses. So especially those who want to proceed medicine later on. Next slide, please. Yep. So for the electronic health record course, to summarize the objectives, of course, you will learn to utilize the EHR. You will be demonstrate mastery in documenting patient records such as allergies, medications, notes, and even discharge and instructions as ordered by the physician. You will be able to document properly and be able to will be able to comply with billing protocols. So, for these two mentioned courses, medical scribe, the EHR, we have this combination involves online instructions, this theoretical situations with theoretical data created by real doctors, and a final examination. The final examination will mostly include multiple choice questions, and there are three attempts, three attempts to be given to students, because at the end of the activity, at the end of the course, the students will get a certification, for two certifications, actually, one for medical scribe and another for electronic health record. So let's go to the next slide, please. The price for the medical scribe course online with the clinical EHR course is $359. And for the other bundle that we offer, online medical scribe plus clinical EHR with the ICD-10. So this ICD-10 is like further discussion on the ICD-10 codes. CPR plus AED and wrong site surgery courses. So you can save for $572. So since this is our a special offer to Nova Southeastern University, we are actually offering a discount to students. So, at this point, if there are students who will enroll or proceed with a sign up, we will give a 15% discount. We actually give just 10% discount to students of other universities, but for a Nova Southeastern University, we'll give 15% discount. And if there are a group of 10 students, a minimum of 10 students who will send their names to us and interest, interested in signing up as a group, we give not 15%, but we give 20% to the students. Next slide, please. For the accreditation, well, we are actually approved by EIM, or the Postgraduate Institute for Medicine. We received a letter from the Director of Operations, and we have been approved to jointly provide the continuing education courses for our courses that we offer. It's actually, it depends on the type of the course. For ACLS, BLS, PALS, we are accredited by AMA, ANCC, ACPE, and ADA. We are also approved for arrhythmia, 12 lead stress test or Halter, CPR, AED, preventing wrong side surgery by the AMA and ANCC. For pharmacy technician, we have an we have an accrediting body for this ACPE, and for the medical scribe with the EHR, it's we have been accredited by the AMA, ACPE, and ANCC. So AMA, American Medical Association; ACPE for Accreditation Council for Pharmacy Education; and ANCC is American Nurses Credentialing Center. So we are, for the scribe alone, we are approved until December 4 of 2022. All right, so the next slide just shows how, I mean, the progress that we made for the medical scribe course alone. So 2017, we had 53 registrations. Year 2018, we for the 2018, it's 83. We had 83. For 2019, we have 38 signups, and just for last year, 238. So if you have noticed, there is a great increase in our last year's program. It is because of the combination that we did with medical scribe program. So we included the EHR for accreditation purposes. I think I'm finished with my part, and I will give the floor to my manager, Janice.
Thank you, Sheila. Now, I will be discussing to you what Monitor Tech courses are. So for Pacific Medical Training, we offer courses for current monitor technicians, ECG technicians, telemetry technicians. So this is divided into two. First part will be the arrhythmia interpretation, and second will be the 12 lead ECG. Please go back to the previous. Yes, thank you so much, Jay. So for our courses, our Monitor Tech program, you will be able to see on our website for monitortech.org that this is recommended by a review program by CCI, or that will be the Cardiovascular Credentialing International. So students who take our complete course for Monitor Tech will be able to sit for a CCI International, as well as, or Cardiovascular Credentialing International, sorry for that, and Certified Rhythm Analysis Technician examination. So what composes of Monitor Tech? So as what I've mentioned earlier, we have the arrhythmia interpretation. Now for arrhythmia interpretation, this is the first part. So this course is for healthcare providers aspiring to take the ACLS course, or for providers working in a monitor technician position. So we have several modules. We have section A, B, C, D, E, and F for the arrhythmia course that we offer. So these are different modules that will help you understand what arrhythmia interpretation is. So this is an entry-level job seekers, if or for any nurse assistant, RN, LVN, LPN, or other medical professionals seeking an additional training or continuing education. This course will be completed within 4 to 6 weeks, but then for all of our courses, since this is completely online, you can take the course at your own pace, at your own time. So this is an accredited course which has 8 CE credits or CME credits, and may be taken for required monitor technician courses. And you need to pass the exam with 84% for you to be able to get a certificate. So if you're curious of what or if you're curious of what our certificate looks like, this is how our certificate for arrhythmia interpretation program looks like. And this is good for 2 years. So this certification will expire 2 years from the day that you pass the course. So the second part of the monitor tech course is the 12-lead electrocardiography. This is a 200 level course for healthcare providers working a telemetry unit. So it will also be useful for working in operating rooms, emergency rooms, and for cardiologists. So this will consist of section A, B, C, D, and E. For the 12 lead electrocardiography, it is actually recommended that you need to take the arrhythmia interpretation first before you will be able to take the 12 lead, but still you can take 12 lead without taking the arrhythmia. That would just be recommended, since you will have to start with the rhythm strips first before going to ECG. So again, same as arrhythmia course, this is for entry-level job seekers, for nurse assistants, RNs, and other medical professionals seeking additional training or continuing education. So same thing, this will still be 4 to 6 weeks, and this is completely online. And the CE credits will still be 8 CE credits. And then certificate, or you will need to have 84% before you will be able to pass the course. This is how the 12 lead electrocardiogram program certificate looks like. So this will still be good for 2 years. So for the prices, arrhythmia interpretation will be $300, and then 12 lead electrocardiography is also $300. And again, we will be able to provide you a discount for 15%. For group of students that will be 10 or more, we will be able to provide you 20% discount. So stress test Halter monitoring training is also part of our continuing education course. Now, Pacific Medical Training stress tests and Halter monitoring, as well as basic life support courses, will prepare you to sit for a CCI, Certified Cardiographic Technician examination also. So this will prepare you to work as a stress test technician, Halter monitor technician, or telemetry technician. So as we all know, heart diseases is the #1 cause of death in the United States. There are actually, when you try to, can you please go to the next slide? Okay, 1 person dies every 37 seconds in the United States from cardiovascular disease. By the way, this is from CDC. So about 647,000 Americans die from heart disease each year. That is 1 in every 4 deaths. Heart diseases cost the United States about $219 billion each year, and that was from 2014 to 2015. So it will be much better if there is an early diagnosis of a heart disease or a heart problem, so that in that case we will be able to cure them. And Halter monitor testing is very important in order for us to be able to determine the cardiac rhythm, and as well as the other problems that goes along with the heart disease or the heart problem. So this will cover a lot. So this will be from sections 1 or modules 1 until 11. And if ever you will take stress test Halter monitoring course, it is just like taking arrhythmia course and taking 12 lead course and much more. So that will be the stress test Halter monitoring course. So this course covers 3 lead, 4 lead, 5 lead, as well as reviews for 12 lead. So as what I mentioned earlier, if you'll take stress test Halter monitoring course, this is the same as taking 12 lead electrocardiography as well as arrhythmia course. So that is why the price here is $800. And then if you have some questions about this, or you want to have some details, you can go ahead and send an email to Terry. Her email address is along with this her information or email address is on this page. So that's terry@pacificmedicaltraining.com, or you can also check for that will be send an email to support@pacificmedicaltraining.com. So this will be the last one. This is preventing wrong site surgery. So what is a wrong site surgery? Well, this is simply a wrong surgical procedure performed in one's body. Now, the reason why we had wrong site surgery is, if you can recall, there were some cases before in which there were some problems with amputating one leg instead of the other one. And there was also an Orlando boy who died because of an incorrect I think that was a transplant or implant of the heart. So that was last 2013. So that is why we decided to have the wrong site surgery course offered. Now, this will only be for 2 hours, and this course is jointly provided by Pacific Medical Training and Postgraduate Institute of Medicine. This activity has been designed to meet the educational needs of physicians, physician assistants, nurse practitioners, registered nurses, pharmacists, dentists, and other members of the surgical team involved in the care of patients undergoing surgical procedure or in the prevention of wrong site surgery. So this will just be for $35 for for preventing wrong site surgery course. So basically, those are the courses that we offer. So one is, this will be for continuing education. So we have Sheila discuss about Scribe as well as EHR. And then I did give you an information about our monitor tech courses. So that will include electrocardiography, or the 12 electrocardiography. We also have arrhythmia interpretation, stress Halter monitoring course, and we also have wrong site surgery. So those are part of the continuing education courses that we offer with Pacific Medical Training, and we are ready if you have any questions.
How would we sign up for the courses if we wanted to take them?
Okay, if you want to take the courses, you can go ahead and check pacificmedicaltraining.com. You will be able to see there the courses that we offer. That is through our website.
And you mentioned before that there was a code for the NOVA students. Do we have to like put in a code, or would it ask us like what college we attend?
You can actually send an email to support at Pacific Medical Training, give us the information that you're from that school, and then you just have to we will just have to give you the discount, or we will prepare the order for you, and then there is a link that you need to enter, and then we will go ahead and process the discount for you there.
And Sheila, thank you so much for taking time out of your day to present on this. I know how great these opportunities can be for our students, and this recording is going to be available on our YouTube page. We're also going to be sending it out through our bi-weekly newsletter, but it was such valuable information and some great offers you kind of offering our NSU students to get certified.
Yeah, so thank you very much, Emilio, and the students who attended today. So my part is about, we actually reached out to Emilio regarding the medical scribe course, and we are happy that we were able to discuss our other courses as well. For the medical scribe, our main contact is actually Robert. 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 I mean, his email is Robert medicaltraining.com. But for students, for other students who have attended today, you can also reach me at sheila@pacificmedicaltraining.com. If, for example, you will register as a group, then you can send the list of your names to me, and I will process discount link for you guys.